Okay, today's morning medicine is antipyrinum. I think that's how you say it. Antipyrinum is made from coal tar, and it's used in all kinds of manufacturing, making uh, makeup and I think drugs, and it was used for skin issues and stuff like that. Antipyrinum is known from the poisonous effects it has produced in old school practices. So, old school practices is the old homeopath or the doctors used to use it. It is in some medications, and it is on. They use it as a skin for skin itching and all that kind of stuff. So there has been many fatal cases have been recorded, and there can be little doubt that it is injudicious injuries from it. That use from the use has determined a fatal issue in many cases that have remained unrecorded. So there's recorded ones and unrecorded ones. So it's coal tar, and like I said, they use it in a lot of manufacturing. People who used it, and the old school practitioners. This is why Hahnemann got away from the old school practices, because they were using things that were poisoning people. Mercury, this antipyrinum, they were using. I don't know what phenazone is the name, the common name, I guess, for the chemical that they're using it in. But that's why Hahnemann got away from it, the old school practices, because he said, we're poisoning people, we're harming people, more than we are doing good. I mean, some of it may have been doing good, but he realized, no, it's doing nothing but harm. And that's why he ended up fighting with these people, because when he went to homeopathy and he saw it was working, and some who saw it was working was using it, but then some of them were like, and it can be difficult to cure cases, because you have to really sit down and think about it, take a case from somebody, and then look up medicines. Whereas you got a skin condition, we'll put antipyrinum on you, you know, and from that, of course, you absorb things in your skin. People are getting poisoned by it, and there's a lot of stuff, mental issues and all kinds of things that happen from it, and from the poisonings, of course, anything that poisons you will cure that type of poisoning, depending on, in that kind of sickness, in any kind of flu or anything. So antipyrinum, skin, scarlet rash, so like a scarlet fever rash, edema, which is swelling, retention of fluid, dilation of capillaries, so it affects the blood capillaries, perspiration, dizziness, cyanosis, which is your skin turns blue because you're not getting the oxygen, somnolence, which is like a sleeping type of thing, leukocytosis, white blood cells are increased, so that's leukocytosis, albumin, induced by antipyrinum, that's where the white blood cells increase. So the body, obviously, when they're using this antipyrinum, they are causing the body to have a reaction like, oh, there's something poisonous going on here. There's something bad. The white blood cells get up to attack it. That's the vital force trying to heal whatever's going on with this. Vasomotor centers. Now that has to do with the blood pressure and things like that. And that's the oblongata. What is it called? The part of the brain. Let's just say that this affects the brain, where the vasomotor centers affected causes the dilation of the capillaries of the skin. So the blood vessels are affected in that. Albumin, which is protein and blood in the urine. So when they urinate, they got protein and blood in the urine. Acute erythema metaphyra, which is a bullseye-shaped lesion. Just like when you get a tick bite, if it turns into a bullseye, that's a problem. That's what they're getting with this antipyrinum. And that could be from the poisoning, or if someone gets that bullseye, I never thought of that for ticks. I just use ledum and hypericum. Fear of going insane. So it really affects the brain. Hallucinations of sight and hearing. So they're hearing things, they're hallucinating. This is why they feel like they're going insane. They're hearing things, they're seeing things, or, you know, and that's all from the poisonings, undoubtedly, of this medicine. Or they did do provings on this. So when they did the provings, these people got all these kind of symptoms, nervous anxiety. So they're not sitting around and, you know, being dopey and all that. They're very anxious and they're moving around and they're not doing very well. Let's see. Nothing in the abdomen, the back, the chest, ears, pain and buzzing, and tinnitus. You know, that's that ringing in the ear. Somnolence. I'm going to look up somnolence. I'm pretty sure I know what that is, but somnolence. And see, you can do this too, because you don't have to have a degree. You don't have to know all these doctor's terms. Yeah, I thought it was excessive sleepiness. You don't have to know all this stuff. You know, that's why, you know, my superpower is I'm not a doctor. I'm not a certified homeopath, but I've been using it for 30 years with my family, and I've become quite adept at reading what's going on with someone's vital force and being able to choose a medicine that works. You know, and of course with the books and that, it makes it a lot easier. So that's why I'm, you know, you can always go to a homeopath, and I suggest it. You know, I suggest utilizing a homeopath, you know, and if you want to be a homeopath, go to the schools. You know, it's, I don't know how, 2 years, 4 years, something like that. But you can do this without doing all that. You can get a kit, you can get a couple books, and I can train you, I can teach you how to read the vital force and to, and actually I'm doing a Zoom call for 30 minutes, maybe 40 minutes, 30 minutes. I didn't pay for the whole thing, so I only got 40 minutes. So I'm going to do a 30-minute call that people can come in and ask questions and all that kind of stuff. And I have a community that has paperwork that you can utilize. And if you have questions while you're in the community, you can ask them, and I can, you know, interact with you to help you to get through whatever situation you're going through with your family. Puffiness of lids of eyes. Conjunctivi is red and edematous. So that's edematous. That's why it's puffiness, because they're retaining fluid with lacrimation. So lacrimation, that's a 3. Tinnitus is a 3. Hallucination is a 3, and of sight and hearing. But lacrimation, that's the, you know, mucus coming out. And red spots on the eyes, which is apis, which is bee venom. Tomorrow is aphids. I don't know if you know what an aphid. It's a little bug. That's the medicine. They made a medicine out of one of them. Then that's Wednesday. Thursday is apis, which is bee venom, which is what that is. You know, that's red spots is apis. Instead of antipyrinum, you can, you know, apis might be in there with that when you look stuff up for the eyes. And then Friday is celery. Yeah, common celery. So it made medicine out of everything. Once they figured this out, man, once Hahnemann did that experiment and he took chicona bark. Oh, you notice my lungs aren't messed up today. I don't have mucus. I'm not coughing like I was yesterday. And that's because I took mullein tea. I don't know if you ever seen the mullein plant, but it's got yellow flowers, a big long flowering stalk that comes up with yellow flowers. Well, I made some mullein tea, and it's very good for the lungs. You have lung issues, drink mullein tea. I take mullein leaves and put them in on my feet, and I tell you what, I don't know what it is about it, but it feels really good. It's apparently supposed to pull out poisons from you. So where was I? Lacrimation, red spots. Oh, edema and puffiness, red and swollen in the face. So edema, again, once again, they're retaining fluid. A lot of puffiness, red and swollen. So there's a lot of red spot. Oh, excuse me. Red spots, red and swollen face. So there's a lot of red spots and things going on there. Itching and burning in the vagina. Menses are suppressed, so their menses don't come. And they have a watery leukorrhea. The leukorrhea, you know, it's not thick or anything, it's just watery. So, but they have itching and burning. Now this is, like I said, a good skin remedy for any kind of itching and things like that. And yesterday's was good for like chicken pox, measles and smallpox and things like that. This one's good for German measles. That it says throbbing headache. So the headache is like what's your headache feel like? Is it pounding, burning, stinging, stabbing, throbbing? Someone says throbbing, you'd be considered. If you look up throbbing headache, if you look up headache, throbbing, you come to. I bet you antipyrinum's in there with some of the other medicines. Now it may not be a 3, a bold one, but I bet you it's in there. Sensation of constriction. There's that constriction around the head again. So that's a 3. It feels like things are constricted. Flashes of heat. So I don't know if that could be, but anyways, they got flashes of heat. Headache under ears with earache. So when they have that headache and it's throbbing, they have an earache with it, and it's under the ears. It feels like it's right in the ear area. That would determine between some other different other medicines with a throbbing headache. Faintness in the heart with sensation of stoppage of heart. So it feels like their heart stops. Throbbing throughout the body. There's more throbbing headache, throbbing in the body. And that's probably from the dilation of the capillaries and stuff. Rapid, weak, irregular pulse. So the pulse is very rapid, but you can barely feel it, and it's irregular. That's probably why it feels like the heart's stopping. Kidney diminished, so diminished urine. They're not urinating as much. And like I said, they got albumin or protein and blood in the urine. Now nerves, there's no limb, no liver, but nerves, big nerve remedy. Prostration, great general prostration is a 3. So they just can't function. They can't move. Epileptiform seizures, that's just epilepsy, where they all of a sudden fall down and they're cramping up and they're moving. But they have these seizures, contractures, things are contracting, and that's when you see an epileptic seizure, they're contracting up and they're, stiff and all that. Antipyrinum with a bunch of other medicines would be considered. Trembling and cramps. So, they can have that trembling hands and that. Crawling and numbness in the, in the body, wherever it would be. That crawling is like the, feels like pins and needles. They have a crawling sensation with numbness going on. Cheyene-strokes, which is more breathing than it is like a stroke, a regular stroke. So the respiration is bad. Apnea, they have hoarseness, they can't speak. Oppression and dyspnea. Dyspnea is can't get their breath. So they got oppression in their chest, can't catch their breath, respiration's bad, and basically that's what a Cheyenne stroke is. I don't know what penis is black. I don't know why the penis turns black, but there's something going on there. Okay, so mouth, swelling of the lips. So there's more edema or swelling from probably fluid retention. Burning in the mouth and gums. Ulceration of lips and tongue. So they have ulcers on there. Vesicles and bullae. Bullae is fluid-filled blisters in the mouth and probably on the lips and tongue and stuff. Small lump in cheek. So they got a small lump in their cheek, probably a gland swelling or something. Tongue is swollen. Bloody saliva. Toothache along lower jaw. So the lower jaw, that's where their toothache would be. Swelling of fluid coryza from the nose. So they got mucus coming out of the nose. It's fluid. Nasal mucus. Okay, membranes are swollen. So there's probably a lot of pain up in there because the nasal membranes are all swollen. Anybody that's having nose issues like that, antipyrinum would be considered. Dull pains in frontal sinuses. Yeah, so they got swelling, pressure, and all that stuff, and dull pains in the front sinuses. No rectum stuff. Erythema, which is a skin condition, that's a 3. Eczema, intense itching is a 3. Urticaria is a 3. That's why I say the old school used to use it as a skin stuff. They would put it on the skin. Appearing and disappearing suddenly. So this obviously urticaria, and that would come on suddenly with internal coldness. So they feel cold internally. Dark blotches on skin and penis. So that's where probably that black penis is coming in. They got them dark blotches on their skin and their penis, and it's probably a bullseye shaped type of thing going on. Sometimes with edema, which is, basically fluid retention, nausea and vomiting, burning and pain in the stomach. There's more burning, burning, burning everywhere. Sensation of burning in the with temperature, abscess, white false membrane. Oh, this is all throat. Sorry. Painful when swallowing. Okay, they have pain. Expectoration of fetid pus. So they got pus coming out. So there's obviously good for an infection in the throat. They have an abscess of white false membrane. So you open the mouth and they got this white uh, infection going on in there, and It's like a fetid. Fetid is smelly pus coming out of the throat. So there's definitely an infection going on. Any kind of throat infections, pyrinum would be considered, and they got a sensation of burning in the throat. So I'm going to get into some vital force if I have the time, because that's what's going on. When the body has these symptoms, the vital force uh, is trying to bring homeostasis. It's trying to heal the body, no matter what it takes. You might have to use gangrene. Is like you have to lose a arm because it's the gangrene's going, and the body's trying to fight that. Let's see, where is it? Antipyrinum. I think there's some reading. Comments: a young lady patient who took antipyrine, sorry, on her own account. So she was, like I said, the old school was using it as a medicine, coal tar, whenever she thought she might be going to have a headache. So she was using it for her headaches, and them headaches are throbbing and an earache and all that kind of stuff. Developed intense dysmenorrhea, which is vagina problems, to which she was not subject. So she didn't really ever have that. But once she took the antipyrinum, she got that dysmenorrhea with depression. This was only removed after she had discontinued the drug. So she took it for a headache. And this is why Hahnemann, wasn't into the old school practice, because, oh, you got a headache, here, take some antipyrinum. Oh, you got dysmenorrhea now. Once okay, stop taking that. Oh, it's gone. I don't know if the headache probably returns. Now, if you had a headache and you took the antipyrinum homeopathically, it would get rid of that, but you wouldn't get the dysmenorrhea going on. Okay. Because like I said, that's the body trying to restore homeostasis, and this antipyrinum's in there, and it's like, oh, we got to get this out. So the dysmenorrhea starts. This was only removed, okay. Later on, she took phenacentum, I don't know what that is, with the result that an eruption of erythema appeared on both cheeks. So now she's got spots on the cheek from taking this other thing, most likely for a headache, which peeled after a few days and recurred persistently. So it kept coming back because she's taking this other drug, most likely for her headache. It would seem from the above that the drug is homeopathic to some forms, at least of neuralgia, which is nerve pain. One patient had cheyenne-strokes, respiration. Okay. Arrhythmia appears first on the face and arms, last on the legs. Hansen mentions its use in bedwetting and nosebleed, better from hot drinks. So, and it says it's antidoted by belladonna. So belladonna's deadly nightshade. You definitely don't want to take that in substance. You want to take that homeopathically. So if this lady had these issues, give her belladonna homeopathically, clear it up, and then start working. You might want to give antipyrinum. That could be the medicine that would take away the headaches and stuff, the headaches she's having, but in a homeopathic medicine. Symptoms are much intensified in persons addicted to coffee in excess. Okay, so that's antipyrinum, antipyrinum, and this is why I say Hahnemann, he got disgusted with it, because you're given, oh, you got a headache, give you this stuff. Oh, man, now you got dysmenorrhea, stop it. Oh, the dysmenorrhea goes away. Okay, let's try this other one, the paralysis or whatever that medicine was. And that starts giving her these blotches on her face, and it can go to her skin and that, but it might relieve her headache, So there's, yeah. And if you're in reality, if you watch TV at all, and you see some of these commercials, everybody's dancing and happy and everything's wonderful and my A1C is good or my whatever's good, my skin condition's good, but now you could have a problem fighting infections, you could have this, you could have that, you could have the other, and that's what was going on in Hahnemann's time. They were like using these substances to cure or to help heal or to try to heal. They weren't healing, basically. They're just palliating the symptoms. Now, like I always say, if you take, if I have a cold, my pains go away because my my vital force is focused on the uh, the cold or the flu, and now I don't, the pain. But once that cold and flu's gone, the pains are back. So that's basically Hahnemann was like, look, we're giving these medicines, they're poisoning people. You're giving mercury to people, their gums are getting, because mercury will cause your gums to rot. And they were putting mercury in your fillings. I think I still have a couple of them. So I take some medicines. Now they say, go get them out. That's quite expensive and that. One guy said he took mercury homeopathically until that stuff, it pushed it out. And then they said that there's another medicine, and I'm not going to get into all this because I haven't proved that it works, but they say that it will grow teeth. It'll grow and it's probably like a calc floor, calc phos, something for bone matter. Like I'm giving them I told my sister to take calc carb. Yeah. Was it? No, maybe it's calc floor. I have to look it up again. But I gave her one of the calcs for her osteoporosis. Now, she would have pain in her hips when she walked, and she didn't know why. And when she went to the doctor, he said, "Oh, you got osteoporosis." So I said, "Well, start taking calc floor." Now her pains are going away. Now this is a long term. It's a low dose. I told her to get it from Amazon. I should get some money from Amazon for sending business their way. But anyways, she started taking that and she said, yeah, my pains are better. So I said, you got to religiously take this stuff. And why people, if the doctor gave you a pill and you'd start taking it, you'd take it religiously. Why people don't take the homeopathic that way, and I've got to check with her and say, are you still taking them pills? So, and they're sugar tablets. That's all they are. It's a sugar tablet. You put it in your mouth. I told her to put it 1 in the morning, 1 at night, and, do that for a while. And what it cost me, I think it cost like $25 for 3 bottles of that. It might have been $12. I don't know. It wasn't very expensive. So I told her, keep taking that, and compared to probably who knows how much the medicine would have been for osteoporosis, but it's outrageous and it's really not helping it. I don't know. I don't want to get into it anymore. So I want to get into the vital force now. Oops. So the vital force, why do I want to get into that? Because that, whether you call it the vital force, the prana, which is what India calls it, the chi, which is what China calls it, chi, prana, vital force, the Tao call it, anyways, those three, and we call it the immune system. Hahnemann called it the vital force because it's what heals you. It's what maintains your, well, let's get into it. It has instincts, it's genetic, and it's instinctive and unconscious. So when something's happening to you, the vital force says, uh-oh, let's take care of this. It works on digestion. The vital force takes care of your, it's unconscious, the unconscious part of you that causes your heart to beat, your digestion to happen, regulates your blood pressure, all that kind of stuff, and depending on what you put in you, well, that's what it says. Heartbeat, breathe, digestion, balance, balancing all your systems in your body, not balance where you're walking, but it balances all that stuff out. It works on fight, flight, adrenal, heals, and fright and grief. So all that stuff is, flight. Now we live in fight and flight. We're always stressed, and there's no tiger chasing us. There's no reason to be stressed. But we're stressed over our money, our, whatever, all our situations, I think Buddha said the suffering that we have is because of all the desires we have. Once you get rid of those desires, now he was rich and he gave that all up. And he realized once you give up all the desires and all the things, you don't have suffering anymore. It's, you're just living. And if you think about it, we're chasing things. We're chasing more. We're running after more. We got to do all that stress is not good for you. But it'll the vital force, if there is a danger, it'll give you fight, flight. It'll kick up the adrenaline. It heals the body, whether wounds or colds or whatever. Fright and grief, it takes care of all that. Okay. Now, how people handle stress and grief tells us the strength of the vital force. So, if a person's vital force is strong, healthy, and doing good, you have something come in, some kind of stress. Like my one of my mentors, he said, if I order a rare steak or something and they bring me chicken, he says I just eat it. Most people would freak out and they'd go, their vital force is not very well. Their vital force is weak, and think about it. Someone can be, if they're sick and they're not doing well and they're weak and all that, the littlest thing can set them off. Where someone's vital force is strong and they're healthy, that's no problem. We'll handle that. That's why he says, I order a well done or a medium rare steak and they bring me chicken, I just eat it. I don't get all fired up about it and crazy, and you don't. So depending on how strong, and that's when a grief comes in and someone has a grief, they lose a family member or something, and they could stay in grief for a long time. Their vital force was weak. Their vital force wasn't strong. We're all gonna die. Like I said, Wayne Dyer, he would always, I can never remember his name, man. Wayne Dyer would always say, life is a sexually transmitted fatal disease. So we're all gonna die. And when someone does pass, and it can be unexpected, some people, if you have a strong vital force, you're like, well, they've left, and that's, their mission's over, they're done. Others, their vital force is weak and they're already sickly and they're not doing well. That could send them into a tailspin, So that's the key, is to get your vital force as strong as you can through diet, through movement, through mental like meditation, things like that. So the vital force, it knows how to heal itself. We just need to know how to read it. So that's the whole idea behind, and that's where Hahnemann differed from allopathic medicine. Homeopathy differed from allopathic medicine, is we aren't fighting cancer. We're reading the vital force, because each cancer is different. Like that guy in India, he had cancer of his ear, and his stomach was the problem, and it was because of what he was dealing with life. He had a lot of stress. His stomach was bad. He went after the stomach, cleared up the ear. A lot of disease comes from disharmony between conscious and unconscious. I know I have to stop, but I can't. So I know I have to stop smoking. That's unconsciously, that, but consciously it's like, I just can't. I can't stop eating this. I need more sugar. I need more of this. That is a disharmony between those two. When the conscious and the unconscious are integrated, you know what you need to do, you know what you need, and consciously you go after it. That's when your vital force is strong enough. Instinct to survive, least vital to most. So it'd rather lose an arm than your heart blow up or your kidneys go, or your something like that. So whether it's got to get rid of a limb or something, that's fine, as long as we survive. And that's, the vital force is not what do you want to say? It just knows. It knows what to do. We take energy in through food, air, water, all that stuff. Vital force transforms it and uses what's needed and eliminates the rest. So that's the vital force working on it. You put something in. Now, if you eat a Twinkie, you'll have this leukocytosis, which is your white blood cells, and they've proved this. You eat a Twinkie, your white blood cells rise up because there's a poison that's been put in you. You eat broccoli and stuff like that, your body says, oh, okay, it takes it in, pulls out the nutrients it needs. What it doesn't need, it eliminates through the urine and through the stool. So that is the vital force, the way it's working. And all we are to do as lay homeopaths or lay people like me, I just read it and I say, what's going on? Now I'm trying to read my wife's situation. She's got a bump on her foot that hurts like crazy. So she compensates by walking weird with her other leg. Her other leg's swollen from using it too much. and I'm not reading it right. So I've got to sit down, do a little meditation, get calm, and say, okay, what's really going on here? I'm trying. Oh, is it the tendon in the foot? Is it this? Is it that? What's the aching from? She needs this. Sometimes it can be very difficult. Other times oh, look, I think I got a hernia. Oh, let me see. Right-sided hernia, look in the book. Oh, lycopodium. Gave it to her 2 days later, gone. Headache. I got a headache. What's it feel like? Throbbing, burning, pounding, stabbing, whatever. I didn't even ask where it was in the headache, forehead, back, I just asked what was the symptoms. And she said, burning. And burning, that's arsenicum. That's the first one to come to my mind, because that's burning is a big keynote of arsenicum. Gave it to her, gone. So it can be that simple. Sometimes it can be more difficult. So, and that's where you come to my community and we can just interact, and I can help you to learn and understand how homeopathic medicine works and how it can work for you and your family. And like I said, I'm doing August 2nd. I'm on a Saturday at 10 o'clock. I'm going to do a Zoom call. I'm going to start putting that out there so people can can come and just interact with me and see if I can help them. All right, that's morning medicine. You can age, but you don't have to get old. 31. I missed by a minute.